Hi, and welcome back to Live Well with Dr. Mel. I have such a treat for you today. A full in-person passive range of motion treatment that I performed on one of my clients that you can easily follow along with. This is great for anybody who is immobile, maybe chair-bound or bed-bound, or somebody that you just want to make sure that their joints don't get stiff and they stay flexible. So if you're ready, let's get started.
If you have a loved one or someone you're caring for that is immobile, cannot walk, or is chair-bound or bed-bound, it's very important to make sure you're maintaining the movement in their joints to prevent sores as well as prevent contracture. So muscles will lock up and not be able to move, making it much more difficult for you to take care of them if you don't do daily range of motion. So as you see, I am performing plantar flexion and dorsiflexion on her right foot, being sure to press the ankle, pointing the toes towards her as far as we can, and then pulling the toes away, pointing it away from her as far as we can as well. And then I will also perform circles. So this will work into inversion and eversion and loosen up the joint, bringing blood flow and circulation to the ankle joint. And I'll go in both directions here. So we started here at the ankle, and then we'll begin to work our way up to the knee, being the next joint. This is a hinge joint, so we will flex and extend the knee here. So bringing the heel as close as you can to her butt, and then raising the leg as far as you can, extending the knee. You see she's slightly tight here, not making it fully into full knee extension, but we go to her end range and then hold it for 3 to 5 seconds and repeat. So we're trying to extend the knee, straighten the knee as much as possible, hold for 3 to 5 seconds, and then lower the heel towards the butt and hold for 3 to 5 seconds. So I like to spend at least 60 seconds at each joint, but anything is better than nothing. So even if you can get 10 reps in, that's fine. So about 10 reps, 3 to 5 second holds at the end range. If the person you're working on has a cognitive decline and can't verbalize whether they're in pain or not, make sure you're peeking at her facial expression to make sure she's not grimacing. And if she is, you want to stop where you notice that she is having some agony and pain. Hold it there for a little while, and then you can try to go a little further and see if she's still making that face. So you'll notice here I moved to a hamstring stretch, placing her heel on my shoulder. My hands are pressing on the top of her thigh, trying to press her knee into further extension. The more we straighten the knee, the more of a stretch in the back of the hamstring there. You see she's starting to try to resist me a little bit. So using a firm pressure through the top of the thigh to get more of a stretch. And then I'm going into hip flexion. So I'm placing the foot on my shoulder here and using my body weight to press her knee towards her shoulder, flexing the hip. So the knee is past 90 degrees, which is excellent. She has good hip flexion range of motion here. So instead of doing reps here, I'm doing a continuous hold. So when you're holding into a stretch, you want to hold for at least 30 seconds to get a proper stretch. Next, I put the foot on the other shoulder, and now I'm pressing into abduction, pressing the foot away, opening the inner groin and stretching the inner adductors here. Same thing, I'm doing a prolonged stretch for at least 30 seconds here. The other benefit of doing stretches like this for the elderly or for people who are bedbound or chairbound is they will get super tight in these areas, making it harder to clean them when you're changing their diapers or Depends, as well as it will be painful for them if they get super tense and tight. So this will help manage their pain and symptoms. The next stretch here is a figure 4. So you see I'm putting the heel of the patient by the knee of their opposite leg and then dropping the knee down towards the floor, opening the inner groin, and then I'm actually massaging her inner groin as well to loosen the muscles there. I find it's very common for people to have tightness into this external rotation and abduction of the hips because we move mostly in the sagittal plane. A lot of times, unless you're doing these stretches, you're going to be very tight in the inner groin. I'm doing a little distraction here now, pulling the ankle towards me, as well as a little vibration, shaking her leg out in order to release the space in between the hip joint and her pelvis. So for people with arthritis, that would feel really, really good to get a little distraction through the joint. So pulling away. So now you see I made my way to the upper extremity, working the wrist into flexion and extension, a 3 to 5 second hold at the end range. You may notice if a patient has Parkinson's, MS, or some type of dementia, they may have a slight tremor when performing these range of motion exercises. Just have a firm grip above and below the joint to help control the tremor from irritating the patient. I will move the wrist into circles just as I did at the ankle. This will loosen up the wrist in all directions, including radial and ulnar deviation. Make sure you perform this in both directions.
You're doing good. Yeah.
If there's a loving support person or family member available, holding their hand or touching the patient goes a long way. Now we're moving distal to proximal at the elbow joint, massaging the bicep tendons, relaxing the bicep because she's tight, not getting full elbow extension, lacking about 5 degrees. Then you can move in the opposite direction, going to flexion, trying to get the hand to touch the shoulder, and then pressing back into extension. So 3 to 5 second holds at end range, going into continuous motion. She has great flexion here, so that's why I did the prolonged hold into extension in the beginning. But you can, if the patient has good elbow extension and good elbow flexion, you can just do 3 to 5 second holds in continuous motion back and forth like I am now. Next, we're going to move into shoulder flexion, supporting above the elbow and below the elbow, pressing the humerus towards the ear. She's only getting just above 90 degrees here, a little tight into shoulder flexion. So I'm just going to do a prolonged hold for at least 30 seconds, trying to press further and further into shoulder flexion. Normal is about 180 degrees, would be touching the sofa. Now we'll move into external rotation and internal rotation of the shoulder. Doing a 3 to 5 second hold at the end range. Supporting above the elbow and below. So this motion will help with reaching behind her back or behind her head in order to wash her hair. And then we're going to finish with a gentle distraction of the shoulder, just like I did on the leg, and a little vibration. I like to finish at the neck because people hold a lot of tension here, and it's a nice way to end a session. Also, make sure you do the other arm and leg. I just did one side for demonstration purpose. So a trapezius stretch is probably the best stretch for most people. So what I'm doing is gently side bending her ear towards her shoulder and pressing the opposite shoulder down to get a nice stretch through the trapezius muscle. And you can do this on both sides. I also move her neck into flexion, tilting her chin in towards her chest. And then slight extension by pressing on her forehead to pull the chin up towards the ceiling. You can do circles as well for the cervical spine. So doing circles in one direction, small or large, depending on her mobility, and then in the other direction. A nice scalp massage is a great way to finish. It helps really relax the patient, can help with migraines and tension.
Well, I really hope this helped. And if you have any further questions or comments, don't hesitate to reach out. I will happily respond. Stay healthy and well. See you next time.